Hi, I'm David Greene, CEO of the Florida Pain Network, where we connect those in pain with pain relievers throughout the state, including pain management doctors and clinics, physical therapy practices, and chiropractic clinics. Today the topic is hormone abnormalities and chronic narcotic medication management. This is a much bigger problem than we thought, and it was presented at the American Academy of Pain Medicine this year. The study looked at over 20 patients who had each been receiving over 10 years of chronic opiate medication management. And they did a full spectrum of hormone levels and blood work on all of them, and at the same time asked the patients how they were doing with regards to certain symptoms overall. And by and large, they said they were doing fine. But in over 90%, the hormone abnormalities told a different story. Well over 50% had low testosterone and another hormone called low follicle stimulating hormone, both of which serve vital roles in various components of the body's homeostasis, such as with bone turnover, so it can have a problem with osteoporosis if there's a chronic issue, mood, energy, libido, fatigue, and stress, and things like that. So that was a big problem, and the researchers felt that people who are on chronic narcotic medication management should have their hormone levels checked by their doctor to make sure that there's not something way off. And in fact, when they went back and talked to these patients who had the abnormalities, a lot of them did in fact have fatigue issues, problems sleeping, energy, stress, that in retrospect they said matched up. Now the other end of the spectrum was a problem with hormone levels that were too high. And the big one in this was cortisol. Over 30% had a cortisol abnormality. Well, what does that mean? Well, the body, adrenal glands make cortisol as a natural steroid, and it helps with all kinds of different things that goes on in the body's organs. But if you have too much of it on a chronic basis, that can lead to blood sugar problems, diabetes, osteoporosis, bone fractures, and things like that. So the researchers thought, well, why is it that they have high cortisol? High stress causes increased cortisol levels. So is it that the pain was not being adequately controlled enough in those patients, and the cortisol levels were therefore going up due to stress from that and the pain being experienced? So they recommended doing further research looking at this, because if a patient has pain that's being managed so-so with the medications and the other treatments, maybe cortisol could be used as an indicator to see when things go awry. You know, if the medication is not high enough, or the dosing or the medication itself needs to be switched, or if it's going like this and the problem elevates with cortisol, maybe it is time to do interventional procedures such as epidurals, facet blocks, or things like that, or incorporate other treatment modalities. That was the thought. I think it's a great idea to do further studies looking at this. At any rate, check out our website at floridapainnetwork.com. You can see when you click if you need a pain doctor or a chiropractor or a physical therapy, you put in your zip code and the options closest to you will show up first. It's geographically targeted. There's a lot of education on the website as well, and we have our YouTube channel and the blog. I'm David Greene, CEO of the Florida Pain Network. Your pain stops here.